Hi, I'm Dr. Lawrence Handler from Michigan Oculofacial Specialists. I practice in the Detroit area along with my partner, Dr. Zachary Pierce. I know there'll be links to our website and various ways that you can get to us so you can see the kind of things that we take care of. But today, I'm addressing a question that comes up all the time in the office, all the time in my personal life, people showing me a various bump or lump around their eyelid and asking me, is this a sty? So today, I'm going to show you some various photos to get you more up to speed about this. I can tell you that when it does occur, that people are usually panicked about it. It's usually a day or two before a wedding or a party, and they really need to get some results. They need to get some resolution quickly. So I'll talk about that too as I go through these slides. The first slide, you'll see a patient with a swelling of the upper eyelid, and you'll see it's right at the lash line and above. And this is significant because there's oily ducts that run in the lid, both vertically on the upper lid and vertically going downward on the lower eyelid. This is where that oil that's necessary for normal ocular lubrication is discharged onto the eye. When these areas get inflamed and there's swelling, you can get a blockage of that duct, and this creates a sty. Complicated slide, but you'll see the area below the lashes. There's a plate that runs, and you can feel it in your eyelid that provides a structure to the eyelid, and that's where these oily producing ducts occur, and they're running vertically, as I said, in the upper and lower eyelid. Not to be confused by other lumps and bumps that occur around the eye. This is a cyst, and you can see that there's a transillumination. You can kind of see through the wall of the lesion. So this is more liquid, not a sty. A sty can be more of a solid structure. Here is a sty, or there's the medical term chalazion that's used all the time. This is what results after that acute inflammation, the early inflammation that can last several days to a week. When it all settles down, you could actually have a hard, solid mass to the eyelid. Not to be confused with other lumps and bumps that occur around the eye. Here's one on the lower eyelid, and you can just see it looks like it's just stuck to the the lower eyelid with the lashes sprouting out. This is not a sty, and there's various ways that these can be removed, and I'm going to save that for some future videos. Got to save something here, so we'll save that and maybe actually show you how the removal is done in an office setting. Again, I think you're already getting good at this. You can see it's not running vertically. It's stuck onto the lid. It's not really disrupting the eyelashes. This is not a sty. This could be confused with a sty, and that's the other thing, that most inflamed bumps on a lid are a sty, probably greater than 90 or 95%, but you do have a segment of various lumps and bumps that are not sties. Here's one that's involving the whole lid, and it looks inflamed, but it's not really inflamed. It's painless, and this turned out to be a lymphoma. Contrasted with, again, a typical sty or chalazion-like picture where there's inflammation. You can see redness along the lash line, both the upper and lower. And again, I know people a lot of times get concerned, is this cancer? Well, when we start involving multiple eyelids, redness around multiple eyelids, the odds of cancer is significantly reduced. But again, this is why in an office setting, when there is a removal, we always send to pathology and we always confirm what the diagnosis is. Here's something that it's hard to know right off the bat. What is this? Is this a sty? Is this something going on in the tear duct system? So on a patient like this that comes into the office where there's significant swelling, again, with the medical knowledge of their medical history and the records, I might put this patient on an oral steroid for a few days, get the condition to settle down, find out if there's an isolated bump, and if needs to be removed, remove it. Again, we're looking at another example of a picture of a bump, but not a sty. You'll see there's lash loss here. Lash loss is very significant. I'm always concerned about lash loss, and you can get that with styes, but this turned out to be a basal cell cancer, and it's easily taken care of once diagnosed. But I pay attention to the lash line, and if there's lash loss, you can get some lash loss temporarily with a sty, but if it's a long history of lash loss, certainly we want a biopsy and determine a definitive diagnosis. But again, for those typical patients coming in with redness, a bump in the way that I've described it, greater than 90% or probably 95% are going to be a typical sty. Here's the extreme. This gentleman came in and frankly, I wasn't sure if these were sties. I was very concerned about this, but ultimately these were removed. Most can be removed in an office setting. His required a surgical setting where he had anesthesia and there was removal, and his picture just a few weeks later demonstrates that you can get resolution very quickly. The bulk of these are removed in the office. There might be exceptions depending on age, depending on anxiety, depending on if multiple lids are involved. So again, I think for a future video. What can you do? I mean, if I had a bump, which I have had, I immediately start a little bit of a warm compress. There's various commercial washes that are available that you can use on the lash line to try and decrease the bacteria count, decrease the inflammation, and do this on your own. If you were coming into my office and it was significant, I spoke about using oral steroids, and at times we'll put just a little bit of an injectable steroid into the bump, which can be done very comfortably, and again, probably for a future video to show you, and it'll give you very quick resolution. So this is a home remedy. You can do some warm compresses, you can do some of these commercial wipes, and at least get the process started, and most will resolve on their own. So I really appreciate the opportunity of presenting this to you, and I look forward to seeing you on a future video.